again, folks. Hello. My name is Cookie Rivera. I am the Outreach Director for the Latino Action Network Foundation, and we are getting set up as people are coming in, and we are setting up our interpretation accommodations as well. So please give us just a couple minutes to get started. And thank you very much for joining us for this Lunch and Learn on the federal cuts related to healthcare. As we are waiting for everyone to get in here, I'm going to also say this in Spanish. Bienvenido a nuestra almorzar y aprender los cortos de fondos federales para entenderlo mejor. Estamos organizando y recibiendo las visitas que van a participar aquí o escuchar aquí en nuestro programa, y gracias por venir y ser interesado a este programa. I will also read in Spanish this interpretation system for those who are coming in while we are waiting. Si deseas escuchar este seminario de web de hoy en español, haga clic como se nota en los iconos allá del globo terráqueo en la parte inferior de su pantalla. Seleccione español y silencie el audio original. Haga clic al globo, seleccione español para escuchar solo ese idioma. Y no olvida de silenciar el audio original, que es el parte de inglés. Okay. And I see that this is being set up, the English and Spanish choices that you will have. So please pick your choice and we will get started as soon as my background angels are ready to say go. Again, I want to just thank us all for being interested in this conversation. With so many things going on here, it's hard to keep up sometimes, but we are very happy that you are here and that you will share with, learn from us, and hopefully ask questions. As many would know, there are ways to ask questions in the chat. You will not be able to speak or anything like that, but you can post your questions in the chat, and there will be someone on the background that will try to answer your questions for everyone who's attending. I'm gonna hush up a little bit for now until I'm given a cue to get started. So, ¿cómo entiendo para lo que quien está presente ya? El lado de interpretación está hecha ya. Entonces, si Dios permite, ustedes están ya entrando en esa parte del webinar y vamos a empezar prontito. I was just saying for the English speakers that the interpretation side is set up, and we're asking anyone who needs the Spanish side to go on and get in there, and then we'll be starting very shortly. So, I will begin to maybe talk a little bit about our foundation as we are waiting for something in the background there, so that we don't just sit here in silence, because I believe that the interpretation side is already set up. Again, my name is Cookie Rivera. I am the Outreach Director for the Latino Action Network Foundation. If you would like to learn more about all that we do, our website address is landfoundation.org. Over there, you will see the different programs that we have. You will see many policy-driven reports in many areas: mental health, education, immigration, housing. You'll see a very intense report on the transformation of the criminal legal system, and ways to volunteer. You'll see information about the New Jersey Million Voters Project, where we're trying to increase the vote for the elections, the upcoming elections in November, as a nonpartisan project. And we're doing a lot of things over here at the foundation. Please visit our website. Please consider volunteering with us. And I guess those are some of the things that I could keep us busy with. How are we doing? Let me just check for a moment how we're doing in the background. Okay, truly just one more minute or two. I also would like to express to all of us that the New Jersey Citizen Action organization is also someone that we have worked with for years now. It is a wonderful organization that does wonderful advocacy, and we're absolutely elated to partner with them for this particular conversation. They are a great source of information for health reasons, for housing things, for many. Please look up NJCA as well. They are a wonderful organization that can share many good things with you. Let me see here. Okay. So this is Laura. I'm going to begin to introduce you to Laura Waddell, and I'm going to read her bio to you, so that as she's setting up her computer there, we can get this part out of the way. Laura Waddell is a healthcare program director for the New Jersey Citizen Action, which is a statewide grassroots organization that has been working to improve social, economic, and racial justice in New Jersey for over 40 years. In her role, Laura leads the organization's healthcare policy and outreach work and convenes, healthcare policy work and convenes the New Jersey for Healthcare Coalition for over 70 state partner organizations that are dedicated to expanding access to quality, affordable health care to all New Jerseyans. Most recently, Laura led the healthcare effort to pass the Louisa Carmen Medical Debt Relief Act, which bans the reporting of most medical debt to credit reporting agencies and establishes additional financial protections for patients. She also leads the New Jersey for Affordable Drugs campaign of almost 30 state partner organizations, which are responsible for passing historic prescription drug affordability programs in the state. She co-leads a growing working group of partners focused on alleviating the harms caused by medical debt. And she continues to work with state and national partners on efforts to mitigate the impact of harmful new federal healthcare funding cuts. Laura comes to the New Jersey Citizen Action with a Master's of Science degree in jurisprudence from Seton Hall University School of Law, a Bachelor's of Science degree in marketing from Lehigh University, and most recently completed a Master of Public Administration degree with honors from Rutgers University through their executive program. And that's a little bit about Laura, and she's also a wonderful, wonderful person to know and extremely helpful in this fight of advocacy that we do here in New Jersey. So with that, I'm going to, my honor to introduce Laura to us, and enjoy.
Thank you so much, Cookie. I so appreciate it. And thanks to Land Foundation, Sarai, everybody, Jessely, and everyone. Gina, I see so many friendly and great faces. So I'm just going to dive in and just talk a little bit. I mean, I feel like y'all know about Citizen Action, so I'm just going to be quick on this slide. But, we offer direct services for our communities, free tax preparation help, including ITIN application numbers and applications, financial coaching, first-time home buyers. We also help to enroll people in health insurance. And then on the advocacy side, of course, healthcare. We do all things healthcare, workplace justice, consumer and financial protection, things and policies and advocacy around good government, of course, electing progressive leaders, and that the Fair Auto Act as well. And that's our website down at the bottom. And so I wanted to just do a brief overview. I feel like everybody probably knows, the big headlines in regards to the new federal policy changes that are coming. They are the largest cuts in healthcare that the nation has ever seen. Over $900 billion in cuts to healthcare. That's going to be Medicaid, Medicare, and the ACA Affordable Care Act coverage, and anticipating up to 17 million people could lose coverage. In addition to that, there's cuts to education of, to the tune of $330 billion. Cuts to SNAP are food stamps program, about $230 billion in cuts there. And just kind of like a snapshot for our state. Medicaid is New Jersey Family Care, and we have over 1.8 million people enrolled. And a lot of the cuts that or a lot of the changes and cuts are kind of targeted to a particular group of enrollees in New Jersey Family Care. That group is what you'll hear me call the expansion group. So there was, when the Affordable Care Act was passed, it allowed for states to expand coverage to a larger or higher income threshold. They went from up to 100% of the federal poverty level to 138% of the federal poverty level. And just those 38 additional percentage points higher really helped a lot of people around the country. But in New Jersey, that was, over a half, over 550,000 people were able to connect to coverage, and almost 30% of adults in the Affordable Care Act expansion group. So that's, it's a big chunk, definitely a big chunk. So that's when you hear me say the expansion group or expansion population, that's what I'm talking about. And just, I know we all know this, but our Medicaid, our New Jersey Family Care Medicaid, it really impacts everyone. I mean, in New Jersey, there's 1 in 7 adults who are on working adults who are on Medicaid or New Jersey Family Care, 1 in 3 children. And in nursing homes, 4 out of 7 of our seniors in or nursing home residents are on Medicaid. 1 in 7 Medicare beneficiaries, 1 in 3 people with disabilities. And of course, we know that our 68% of non-elderly Medicaid enrollees are people of color. And we can kind of see, if we add the pieces of the pie that make up our Medicaid, we can see that just how the majority of the folks in this program are persons of color. Of course, 30% of our births in the state are covered by Medicaid, and much to what some may say, actually, the majority of the people, adults in Medicaid, they work. They're working. These are, the working population, working class people. And if you think about it, the folks who aren't working are children because our, children are enrolled in Medicaid. And as we see, 4 out of 7 folks in nursing homes. So our seniors are children. That's, the majority of the folks who are making up those folks who are not working and receiving Medicaid benefits. So this is certainly a program that the majority of the people do work. And I want to, I'm sorry, I didn't realize there was like that big flyer. And I just wanted to kind of give a snapshot of, what the impact of the cuts will be for our New Jersey Family Care folks. And so it's been reported by the Department of Human Services, New Jersey's Department of Human Services, that we could see up to 350,000 enrollees lose New Jersey Family Care health coverage. That's like 1 in 5 or 20% of our enrollees are anticipated to lose coverage because of these cuts that are coming down the pike from the passage of the new federal budget policies. And I just kind of wanted to go through the timeline because there are the way that these policies are set up is that all of the detrimental impacts are not going to be felt or seen at once. And so there's, kind of little by little, these new policies are going to be implemented. And so, and it's by design. And so I call it kind of like a snowball effect. So, it kind of starts with, smaller things that are impacting a smaller group or population of people. And then by the time, all of the programs or all of the changes are implemented, over the next few years, when you look back, it's big snowball and you're like, oh my gosh, like all of these, there's been a lot of changes, a lot of people like, are losing coverage, or a lot of policies have been upended. And so, we're looking at, this bill was passed and signed into law on July 4th, and so immediately there there are cuts to reproductive health. This is a pause for 1 year, a funding pause to reproductive health programs for 1 year. So a year from then is when funding is anticipated to be restarted to reproductive health programs. But starting right then and there this year, funding was paused. There's a cap also that was immediate on new, what's called new provider taxes. And then beginning, and this is in regards to New Jersey family care. And beginning in October of next year, there are changes to qualified immigrant statuses, and that could result in up to 25,000 of New Jersey family care enrollees losing coverage. And in January of 2027, that's when what's called these work requirements are supposed to start. And the work requirements are zoned in, as I mentioned earlier, on that Medicaid expansion population, that ACA Medicaid expansion population. So, what they are going to do is they are going to require this population of individuals to work at least 80 hours a month, or log volunteer hours of 80 hours per month, or be enrolled in school. And for enrollees without children, this will pertain to, and parents with children over 13 years of age. So those work requirements will be implemented or effective for that population of New Jersey family care enrollees. There's also eligibility reviews. They are making that more frequent and for this population. And so they will have to prove their eligibility every 6 months in order to remain active in New Jersey family care. And then any retroactive coverage, like if you're going through uh, your eligibility renewal or something similar, they will only allow for retroactive coverage for 30 days for this expansion population. They will allow retroactive coverage for 60 days now for the traditional population. So that's enrollees other than the expansion population, enrollees who are have an income of uh, uh, up to 100% of the federal poverty level. That would be considered the traditional population. And just so you know, this retroactive coverage used to be 90 days. So they've shortened this coverage for everyone, but really shortened it for the expansion population. And also, this expansion population will have to, beginning October of 2028, have to start paying copays for their doctor's visits. So, and these copays are $35 per visit. And so this, wasn't in effect before. And so now that will be in effect. And again, just to give you, an idea as to who is in this population, this expansion population. These are, you know, low wage individuals with incomes of $1,300 to $1,800 per month. It's not, these aren't millionaires or anything by any means. These are people with low incomes, and they are, you know, setting these new regulations and requirements on these low income individuals. And then I know we all have been so proud of all the work that's gone into creating the Cover All Kids initiative, legislation initiative, all of the success that it's had. At last report, there were, close to 47,000 undocumented children enrolled in the program. And because of all of the all of the advocacy and the pushback from the advocate community, like yours and others around the country, we're able to um, we're able to make sure that certain even more detrimental cuts did not get included in the final bill that passed. So that was something good, of course, because that meant that at least for the coming budget for the state of New Jersey, that the governor and the legislature and the Department of Human Services is tentatively, saying that, they're able to support the allotment that was put in the budget to continue to sustain the Cover All Kids expansion program. And so, I would say that, we feel pretty good about it. I don't, now with everything like changing on a whim, you just, out of Washington. I never say absolutes like really anymore, but I feel like we can tentatively say that the Cover All Kids program is safe for now. And we continue to re-enroll our children in the program and continue to enroll any new children as necessary. So that's some bit of positive news. And so, we talked about the impact to New Jersey family care, but there's also impacts to Get Covered in J, our ACA marketplace, our state-based marketplace exchange. And, you know, starting with the end of last month, it was official that unfortunately, the DACA recipients who last November 1st, last open enrollment, were able to enroll in Get Covered in J marketplace coverage. They unfortunately are no longer able to enroll in Get Covered or any ACA marketplace, state-based exchange or the federal exchange. So that eligibility has been taken away in with the new federal policies that now apply also to states as well. So it's terrible to see. We had about 500 DACA recipients enrolled in ACA coverage. And while we have heard that their plans may not have been terminated right on August 25th, we're still waiting to hear for those who were already enrolled what the state is going to do. I don't. We're just waiting to hear. When will those folks' coverage end? Maybe they will allow them to remain covered through the end of the year. I don't know, but we know that beginning, our open enrollment or even special enrollment beginning August 25th, and our open enrollment, which begins November 1st, we know that no new DACA recipients are eligible to enroll and get covered, New Jersey. So, and then it also paused the low income enrollment for, or I should say, the year round enrollment for low income individuals. So this is people who are making less than 200% of the federal poverty level, or 23,000, a little over $23,000 per year. Those folks, if they earned this amount and they were uninsured, they were able to enroll and get coverage anytime. And they didn't have to, only wait for open enrollment or wait for a qualifying life event to happen. Their qualifying life event was that they had low income, and they were allowed to enroll in throughout the year. Well, with the new federal changes, they have paused this year-round enrollment and are for 1 year. And so next August, it should be restarted. But for now, unfortunately, low-income individuals up to this threshold are no longer able to enroll outside of open enrollment, or if they have another special enrollment qualifying life event. And then something that's impacting an even larger population of people is after the end of this year, there will be $500 million in New Jersey ACA premium tax credits that will expire. And this is what makes enrollment in the marketplace more affordable. So I should say the enhanced premium tax credits will expire. There still will be some federal tax credits that are applied to ACA or New Jersey Family Care enrollees, but through the one of the the IRA, the Inflation Reduction Act, that was passed a couple years ago, also added additional premium tax credit amounts that made enrollment and premiums more affordable for people. So that is going away. And in January, they're removing the eligibility for certain lawfully present immigrants and refugees. So that will become effect January 1st of next year. Gender affirming care no longer covered as an essential benefit on the marketplace. And they're eliminating the income change as a qualifying life event of special enrollment. And all of that starts in January of next year. In November of next year, the open enrollment period is being cut. So right now, ever since we've had our state exchange, through this year as well, our open enrollment has been November 1st through January 31st. So we've had 3 months of 3 months opportunity for people to enroll in coverage. Because of the new federal rules, it is being cut down. And for states, they could do up to 9 weeks or 2 months. So it has to end by December 31st. So we'll have, starting in November 2026, November and December will be the open enrollment months. And there will be new income verification requirements for those who are looking to enroll in an ACA marketplace plan. And so, just showing like how this is going to impact um, folks in New Jersey in 2026 because of that $500 million in enhanced premium tax credits that they're letting expire. 454,000 individuals will see their premiums increase by 110%. And so that's like 88% of enrollees will be paying more because they are letting these tax um, um, enhanced premium tax credits expire. And so, just kind of like as an example, for a single person for a single person, they will see their premiums increase by over $1,200 per year. A family of four will see their premiums increase by over $4,100 per year. um, you know, Older enrollees, I'm sorry, um, it will increase, and an additional 5.1 million people nationally are anticipated to lose ACA coverage because of the enhanced premium tax credit expiration. So this is going to be big. It's going to be felt by a lot of people. And, in a time where healthcare costs have been continuing to rise, people just will not be able to afford to see their health insurance premiums increase even more. So this is going to be detrimental. And we're also going to be seeing impacts of cuts to Medicare as well. So there's Medicaid, we'll be seeing cuts. New Jersey Family Care Medicaid, the Get Covered NJ ACA Marketplace. We'll be seeing drastic impacts and cuts, and we'll be seeing impacts of cuts to Medicare as well. So beginning, exactly, yes, this is a war on the poor. Um, we'll be seeing cuts to automatically at the bill signing in July. There's a pause on the implementation of the minimum staffing requirements for long-term care facilities. And what that means is in the previous administration, there were put in place to be implemented an increase in minimum staffing standards and requirements for long-term care facilities, which is a good thing, right? These new policies under the new administration that are coming out of Washington actually puts a pause on those, and a pause that is due to not restart until 2034. So that's a long time from now. There's a moratorium on certain Medicare savings program eligibility and enrollment provisions. And then in January of next year and beyond, we'll see weakened Medicare's power to negotiate better drug prices, delays in the implementation of lower drug prices on certain drugs already negotiated by the U.S. Health and Human Services. And if just as a quick reminder, also in that Inflation Reduction Act that was passed a couple years ago, came the ability for Medicare to negotiate better prescription drug prices for those enrolled in Part D. And so, the first year they identified 10 drugs, the next year it was like 15 drugs, and, each year after, they increased the amount of drugs that would be negotiated. And so, the power for Medicaid to do this, because of some of these policies has been weakened. And so this will impact, our seniors and those who are enrolled in Medicare. And then in July of 2027, Medicare coverage limitations for immigrants will take effect. So they are limiting that. So, there's just, if you think that, if you're not enrolled in Medicaid, it's not going to impact you. If you're not enrolled in an ACA marketplace plan, it's not going to impact you. Or if you're not enrolled in Medicare, it's not going to impact you. You would be mistaken. These changes are impacting all those programs and more. Yeah, thank you.
Laura, I think there's a quick question in the comments on what are Medicare savings programs?
Medicare savings programs. Oh, so they have special programs within Medicare. Let me see if I can put in the chat what they all are. And while I do that, I could take another question if anybody has them.
There's another question on if you know about the July 2027 change that mentions immigrants. Does that mean green card holders as well?
The July for the immigrant statuses and things and access.
Mm-hmm.
Right. So they have totally changed. And I'm putting in the chat right now. Go to everyone. Wait, hold on. Everyone. Here we go. About the Medicaid savings programs. Yeah, so they have changed some of the what they call qualified immigrants. So what you would need to do is look to see what they consider the new qualified list of qualified immigrants. Let me see, I may even have that on a slide. Or you know what, let me put that in the chat too. And while I get that, are there any other questions?
Yes, I'm seeing someone, Patty commented that they have a developmentally disabled daughter, which Medicaid pays for her day program. What are the impacts of these programs, if you know?
For our those with disabilities, basically. So there's a few things that I know of, more I'm sure that I don't. But one of the things, and I think we'll talk a little bit. I think I left in the slide for education on here. But if not, uh, some of the programs that are being cut within the education budgets are affecting. Is that in there? Did I put it in here?
Let's see. We have
No, maybe I took it out. Okay, so you could go back. So I may have just taken it out. It was in one of my other presentations. Sorry. Um, so um, so education is being cut, and some of the I think it's Title 10, I want to say, Title 10 budgets, for that impact low income folks, but also children, some of the programs, I think it's IDEA programs that impact our special needs students. Those programs are being, there are cuts to those programs, to the funding of those programs in the budget. So just depending on, and those programs are used for school Medicaid, they're used for mental health mental and behavioral health programs, and so for students. And so, so those are just some of the things that are some of the populations that are being impacted.
There's another question, I believe, but we can hold off on that one to get through the rest of the PowerPoint.
Okay, and then this is the let's see, and then this is the list for the new qualified immigrants. Let's see, here we go. I'll put that in the chat. If that's and so, and like I said, this is impacting everyone. It's impacting everyone because there's cuts to hospitals. Our hospitals in New Jersey will be seeing cuts to the tune of over $3 billion in federal funded cuts to hospitals. And these cuts will be seen between 2026, October 2026, through October 2029. States are no longer going to receive the extended what's called FMAP or matching funds for non-qualified immigrants who would qualify for Medicaid expansion if not for their immigration status. That's going to impact hospitals. They're capping at $360 million in annual Medicaid reimbursement through provider taxes. This is 2028 through 2032. And this will impact our also charity care. We anticipate that charity care cases will rise because of all of this folks who will be termed or not able to enroll in our healthcare programs. This will increase the amount of charity care cases. And now we know it's kind of going to be like a circle where folks are going to lose coverage, hospitals, and they'll be looking to hospitals for their care or primary care in some instances, and hospitals are not being reimbursed for the to seeing all of the some of these new populations of people, and then they will have to they will see a change in their budgets and lines and perhaps services as well. So it's just a going to be kind of like a cyclical thing in some ways, where it's just a rolling again the rolling snowball effect of these changes. And so we're also going to see the impact of cuts to our what's the next slide? I think it's the federally qualified health centers, but let me see. Yeah, our federally qualified health centers we are anticipating. I haven't checked yet to see if there's any new news. But there are 23 federally qualified health centers, 138 sites in our state, and they see a lot of our people. They see people regardless of their immigrant status, regardless of their insurance status, and if federally qualified health centers are to be receiving less reimbursement, it will certainly impact how they will be able to continue to function and the way in which they will be able to continue to function and who they will be able to see. So, we know that there are efforts, and I think the next slide is about that. Yes, there are efforts going on to stop some of these, the implementation of some of these new rules regarding restricting, immigrants from healthcare, and we are, still waiting to hear about them. But we hope that they will prevail. There has been a slight delay in some of the implementation, but you know, it's just a sad day when we're seeing populations of people being denied eligibility and access to healthcare in our country, in our state. So more to come on that. And so we have some resources, and I will forward this. I realize I probably I didn't get a chance to forward this to Sarai, but we do have a fact sheet, and it is available in English and Spanish with the timeline of all of these, a lot of these new changes to healthcare in New Jersey. So it's kind of these are all the things you should know. So an easy one pager that you can take and keep and share, with your families, your communities. So I'll be sure to send that over. That there is a link in the slide, but I think it's to the English version only. So I'll make sure I send you the link to the file that has English and Spanish in the same file. And it basically goes over everything that I told you. And then the other thing, or on that slide, if you go back one more, because I think, we have a new website, because I am also sorry to say that because of all these changes and this, the increase in uninsured that we will see, there will be more people with medical debt. And we already had over 1.5 million people in the state with medical debt. So now we've launched a website, endmeddebtnj.org, that provides information on how to navigate medical debt, how to navigate medical billing. If you are being sued, provides information on the court process, even gives some template answers to different court, documents, and so it's a great tool for anyone to use who to help them get through their medical debt, or even just to educate yourself on what the protections that you have currently in the state around medical debt and medical billing. So yeah, it's maddening. Exactly. Next slide. And this is just kind of like an example slide, so you can, kind of bring it all together in regards to what the how the new changes will impact different types of people. So this shows James. He's an Uber driver. He makes about $1,500 a month, and he doesn't have children. He's enrolled in New Jersey Family Care. And he also is the primary caregiver for his elderly mother. So because of the new policies that are coming, he's going to be required to prove that he maintains 80 hours of work per month. He will start to pay $35 copay for his doctor's visits, and he'll be required to reapply to New Jersey Family Care every 6 months. The middle one is Mary, a 40-year-old, and her daughter Emily, who's 5. The annual income is $85,000 per year. Emily has a chronic medical condition. They're both get covered in NJ ACA enrollees, and currently receives $193 per month of an advanced premium tax credit and $100 per month of the state subsidies towards their premiums to reduce the cost of their monthly premiums. As a result of the new policies, as of January 26th, their monthly premium amount is expected to increase their premiums anywhere between $1,300 and $4,000. Their federal premium tax credits will be reduced, and their state subsidy will not be able to make up for the loss of the federal tax credits. And then we see Martin, a 90-year-old. He resides in a nursing home, and he resides in the memory care unit. And as a result of the new federal policies, he will receive less nursing care due to the delay in the implementation of the new minimum staffing requirements at long-term care facilities. So you can kind of, put faces with some of these new policies and their impacts. Next slide. So what you can do. One is, this is a lot, and the more people that know what's coming and when, the better that they can be prepared. So educate yourselves, educate your communities, educate your networks. Continue to collect stories, because we need to hear about how these new policies will be impacting our residents. How are they directly impacting parents, seniors, workers, and the like? We want to hear about that. Get involved in the actions of the individuals, quite frankly, in New Jersey, who helped be responsible for bringing these detrimental policies to pass. And there are activities and actions being planned in the districts of those individuals, and so get involved there. And we've passed the comment period for that August 13th deadline, which is fine, but there'll be more to come. So definitely get involved there. And let me see, do I have another? Yeah, as I said, tell us your story. There's the QR code here. We're always collecting stories. Let's see, next. I think we're almost, yeah. And let us know, go to njcitizenaction.org/BBB-impacts. And, to learn more and stay up on what are the new things coming. You can also get the list of the one pager. I'm sorry, my brain. And so yes, I thank you all so much. You can contact me too if you have questions, if I can be of assistance, if your organization would like to, have something like this, a lunch and learn to, update your members or your communities, we'd be happy to. And my contact information is there. And of course, Sari I'm sure would be happy to connect us as well. And share this, because the more folks are going to be needing direct service help to, help to get enrolled in healthcare, to know if they're still eligible or not in healthcare. This is a way you can call us. You can send an email to schedule an appointment an enrollment appointment with one of our enrollment assisters. So thank you.